right now I would like to explain what does it mean the public policy. Public policy is a subject of creation of policies through the government in any country, you know. And it means through implementation of legislation, of adaptation of some strategies, some strategical plans, and so on and so on. It's a responsibility and duty of the government. It's a public health issue. And inside this public health policy includes decisions which is needed to create health policy in the countries. And my colleague already mentioned and described public health, what does it mean, the public health, what's the responsibility of public health, and I would like to add that the policy, public health policy, is the policy which based on the needs of public health. There are some needs described in the left side, and you can see it's for example, if you would like to have a proper sanitation, you should have proper, how to say, legislation in this regard, some control systems in this regard. Then, if you would like to control non-communicable disease, you should have a surveillance system, for example, some preventing programs and projects, and you should have top, how to say, priority in public health policy. Regarding healthy public policy, what does it mean, sir? First time, this definition was made through the US researcher, Nancy below in 1986. It is a period of creation of Ottawa Charter, you know, and there is a good definition of and links in a healthy public policy issue. It's a duty of governments. You know that health is multidisciplinary issue, and to respond all needs and resolve all problems in this issue, it's not enough to distribute some services or make the decisions only through Ministry of Health, who is responsible in creation of public health policy, for example. And I give you, I would say, concrete and more simple example. What's the duty of the Ministry of Health, and somehow inside the Parliament we have some body who works in creation of public health policy. To it's a public health or health committees. It's the Parliament, but most important part is the Ministry, who creates the drafts for adaptation through the government, and government through coordination of Ministry of Health, who is sitting inside the government, should look and monitor the decisions made by the government. For example, if a government making decision in economic point of view which could affect the health interests, Minister of Health should, how to say, fix their position, and somehow in this process should be involved non-governmental organizations, who has more, how to say, voices from the civil society and ordinary people and communities. I will give you some examples in this issue. To put the healthy public policy into agenda of the government, there is sufficient role placed non-governmental organizations. I give you examples of cooperation and collaboration to create a healthy public policy through WHO, for example. WHO has cooperation with international non-governmental organizations, for example, International Union for Health Promotion and Education, which has a consultative status with WHO, and they together, it's a voice of societies in different countries. They have capacity of well-known specialists and professionals in health promotion issues, and they are working together to create some drafts, some drafts of policy drafts, and then WHO will adapt it and will distribute through their agencies to be considered through the governments in different countries. What do the health promotion policy in this issue? health promotion policy must choose strategies, some systems, some skills which is needed to distribute healthy public policy in the governments. And what we are doing as health promoters, we should move the societies, local societies, for example, non-governmental organizations, and push governments through advocacy efforts to change the policies, to draft some policy documents, to adopt some legislation, to enforce legislation and regulations, to receive the results and to receive public good, healthy people. In local level, I can give you an example of my organization. For example, it's Georgian Health Promotion Education Foundation, which works very close to the government to adapt strategy in health promotion. We are working with International Union for Health Promotion and Education. Our organization is a part of this society, and we are, receiving very big support from them. It's experiences, different countries. It's well-known, experienced people who are helping us to create some policy and give us advices, which we are distributing to our government. And through this way, we're trying to change the policy in the country. It's a practical issue, and we are working in this direction. In a local level, local communities, local non-governmental organizations working together with local authorities and local communities to change the policies, to move forward and implement some measures which is needed to improve the health of people in local areas. Monitoring and evaluation is most important part in this issue, and sometimes when policy is done and political decision is made, there is needed monitoring the unit of implementation. If you have a law and it's not work, it does not make sense, then you should follow and you should check anyhow the step how policy was developed, how policy is developing, and look, inform population and policymakers to do additional efforts to implement their agendas or their policies. I would like to give you one example regarding policy document in European region. This document was made just a few months ago. It held in Tallinn 4 months ago. There was held European Commission, WHO's European Committee meeting in Tallinn, and they adopted new charter in public health issue through in European region. And this document gives us some mechanisms and some new definitions healthy public policy. And it calls inside this document, the name of this policy is health systems. And what does it mean, health systems? Health systems provides activities and influence the policies and actions of other sectors to address the social, environmental, and economic determinants of health. It's you know that health systems are more than healthcare system. It covers health prevention measures, health promotion, and efforts to influence other sectors to address health concerns in their policies. And regarding monitoring and evaluation, I already mentioned this issue, and in this chapter you can find some mechanisms how to implement such policies in the countries. They giving to the